How can you get a correct celiac disease diagnosis? Imagine feeling tired all the time, having stomach troubles, or noticing skin rashes, and wondering what's really going on inside your body. Getting an accurate diagnosis of celiac disease can seem tricky, but it's all about following the right steps. First, it's important to keep eating gluten before testing begins. Cutting out gluten too early can hide the true signs of celiac disease and make tests less reliable. The process starts with a detailed medical history. Your healthcare provider will ask about symptoms like diarrhea, bloating, stomach pain, fatigue, weight loss, and any family history of autoimmune conditions. They might also check for other signs like skin rashes or joint pain. Next, blood tests are used to look for specific antibodies. The most common one is called tissue transglutaminase immunoglobulin antibody. This test works best when you are still eating gluten. Sometimes, additional tests are done, especially if you have low immunoglobulin levels or other autoimmune diseases. If the blood test suggests celiac disease, genetic testing might be recommended. This involves checking for the presence of HLA-DQ2 and HLA-DQ8 genes. These genes are necessary for celiac disease to develop, so if they are absent, celiac disease is very unlikely. However, having these genes does not mean you definitely have celiac disease. The most definitive step is an intestinal biopsy. During an endoscopy, a doctor inserts a thin tube with a camera into your small intestine. They take small tissue samples from the duodenum, which is the first part of the small intestine. Under a microscope, these samples are examined for damage like villus atrophy and inflammation, which are signs of celiac disease. This procedure usually takes about 30 minutes and is done under sedation. After diagnosis, you will be advised to follow a strict gluten-free diet. Symptoms often improve, and antibody levels decrease when gluten is removed from your diet. Sometimes, if symptoms are very clear and antibody levels are high, a doctor might diagnose celiac disease without a biopsy, especially in children. It's very important not to start a gluten-free diet before testing because it can interfere with the results. Always work with healthcare professionals, including gastroenterologists and dietitians, to interpret your test results correctly. Follow-up testing can help monitor your progress and ensure your small intestine heals. Getting the right diagnosis is a step toward managing celiac disease effectively. It helps you avoid unnecessary restrictions and guides you to live gluten-free with confidence.